Welcome to an overview of the step-by-step basic operating procedure of the HistoFreezer Portable Cryosurgical System. HistoFreezer is an easy-to-use, effective, and quick in-office portable cryosurgical system to treat patients with common warts and benign lesions. It is for use by medical professionals only. This video demonstrates 3 common patient presentations. Step 1. Choose a HistoFreezer applicator. Use the 2 mm for smaller lesions or the 5 mm for larger lesions. Step 2. Insert the HistoFreezer applicator into the HistoFreezer canister. Step 3. Remove the protective cap and hold the canister upright, with the applicator pointing away from the body. Press the dispensing valve for 3 to 5 seconds to charge the applicator. Saturation of the applicator is complete after several droplets fall from the tip. Step 4. Point the applicator downward and wait 15 seconds for it to reach its effective working temperature. Do not press the valve while the applicator is in contact with patient skin. Step 5. Face the wart in an upward position. Step 6. Point the HistoFreezer applicator straight downward and apply the tip to the wart for 40 seconds using a slight and continuous pressure. The tip remains at the effective temperature for 90 to 120 seconds for treatment of multiple warts on the same patient with one properly saturated applicator. See the HistoFreezer instructions for use for lesion-specific treatment times. Discard the 2 mm applicator after 1.5 minutes of use and the 5 mm applicator after 2 minutes of use. If necessary, repeat the treatment at 2-week intervals. Use a new applicator for each patient. Step 1. Position the foot to debride the wart area to pinpoint bleeding prior to applying treatment. Hint: use a hemostatic solution to stop the bleeding. Step 2. Repeat steps 3 and 4 of the basic HistoFreezer operation procedure. Step 3. Point the HistoFreezer applicator straight downward and apply the tip to the wart for 40 seconds using a slight and continuous pressure. If necessary, repeat the treatment at 2-week intervals to reach resolution. Discard the 2 mm applicator after 1.5 minutes of use and the 5 mm applicator after 2 minutes of use. Use a new applicator for each patient. Step 1. With the 2 mm HistoFreezer applicator installed, repeat steps 3 and 4 to bring the applicator to the effective temperature. Step 2. Grasp the skin tag with tweezers and gently pull it away from the base. Place and continuously apply the applicator tip to the skin tag base for 40 seconds. The skin tag may change color during and after treatment. Here is a summary of the approved indications for HistoFreezer Portable Cryosurgical System use and treatment times. See the instructions for use for details and precautions.